Good evening, everyone. I'm delighted to welcome you all to the seventh webinar of the National Research Methodology Course and Workshop organized by Global Association of Indian Medical Students, GAIMS. My name is Raj Vidav and I have the honor of serving as the Assistant National Director of Research, and I will be your host for tonight's session. This workshop is designed to enhance research competency, foster evidence-based practice, and equip participants with the tools of effectively plan and execute research projects. Today's theme, How to Write a Scientific Paper, focuses on the foundational steps in the research journey. On that, bridges the gap between data collection and real-world impact. During this session, we will explore crucial aspects such as conducting an effective literature review, mastering database search techniques, scientific writing, understanding plagiarism, and managing citations. These components form the core of any successful research manuscript and are indispensable for producing credible and meaningful scientific contributions. To lead us through this discussion, we are privileged to have Dr. Anujit Paul. He is a consultant specializing in cataract and vitreoretina services at BDI Foundation, Kolkata. He also served as an assistant professor at Ramakrishna Mission Seva Prasthan, GIMS, Kolkata, and holds visiting consultant position at B.R. Singh Railway Hospital and M.N. Chatterjee Memorial Eye Hospital. He is a fellowship-trained specialist in retina from BVI Foundation. Dr. Paul has earned prestigious honors such as the IGO Platinum Award in 2021, TNO Gold Medal in 2021, and Dr. Ranja Ray Younger Ophthalmologist Free Paper Award in 2024. With over 35 PubMed index publications and contributions to two book chapters, he is a prolific researcher in his field. Dr. Paul actively mentors MS and BMD postgraduates, particularly in cataract surgery training, and serves as section editor for Retina for the Tamil Nadu Journal of Ophthalmic Sciences. He is a key member of several professional bodies, including the Executive Committee of the Ophthalmological Society of West Bengal, the Kolkata Association of Ophthalmologists, and the Young Ophthalmologist Society of India. Dr. Paul's commitment to academic excellence, clinical expertise, and mentorship continues to inspire the next generation of ophthalmologists. With further ado, please join me in welcoming Dr. Anjit Paul.
Hi, good evening. Hi, Rajvi. Thank you so much for the kind but really long introduction. I think we have 53 people. So, thank you once again to the entire organization and team. You guys are doing a lot of good work. And it's good to be on a platform speaking about research, something that piqued my interest when I was an undergraduate and then a postgraduate. So, can we begin? Okay, great. So I'll just share my screen. I just hope, just let me know if everything is visible and audible and all that.
Yeah,
So
sir, you're audible.
everything is fine. Okay. So good evening, everyone. I'd request everyone if you can just add your questions in the chat box so that someone later on or myself can answer them. Because usually in 2024, webinars are slightly difficult with the changing trends during COVID. All right. So usually when I speak in forums like these, usually people who are listening have questions like either they want to start publishing and they want to conduct a research study, but in most cases, they don't have a mentor and they don't know when to begin or where to begin. So if you're at this position, I think this webinar is probably the perfect place for you to begin. And I hope I can make things a little bit lucid and easy to comprehend. So this is a usual annual talk which I speak about, and we have it in different versions in different forums. So I'll just escape all these things and go into why should I even consider publishing. So many of you are publishing because you have a requirement to publish. Many of you have considered publishing because you need to get some goal achieved or you need to show it on your CV. But in general, once all these hurdles are done with, for example, for myself, I don't have any need to publish. I don't have any promotion or any exam that I have to clear anymore to publish. So why should someone like myself still consider publishing? So what I tell people mostly to remember is that publishing is the easiest way to stay updated in your field. It gives you a very good base to learn what you want to. For myself and for many people, there are a lot of forums where you can be visible because of your publications. It serves as an alternate source of recreation, income, as well as reputation for many people, being known for their publications besides being known for their specialty. And nowadays, it's become very easy to build a new portfolio, just like you have TikTok and Instagram and Facebook, etc. So there are similar sites for publications, and because of the plethora of journals, especially online, that have come up, you have a lot of role to play. Keep yourself busy, earn a pretty good income, as well as get yourself visible. So as far as being visible and knowing your portfolio is these are slightly older values. So if you can have a look at citations, so if you amass a status in which you can get a decent amount of citations, this one over here, this is Google Scholar, and the first one is ResearchGate. So these are very professional sites that pool in your data, which is available all throughout the internet. So ideally, if you have a PubMed index, Scopus, or Copernicus index publication, it will pool in the data and you can make the most of it. So this is data, I think this was last updated in 2023. So as you can see that I had somewhere around an average of 80 citations in every month. So that helps pool your data and create a high impact profile for yourself. So it doesn't happen overnight, but there are certain advantages over here. So this is what Google Scholar does. But if you have a look at ResearchGate, depending upon the number of people who are reading your data on ResearchGate, it gives you citation score and research interest score, etc. So it is a more formal way to express your work. If you are interested, if you are beyond 5 publications in the future, these are good places to start off with. So there are some advantages of knowing research and having an idea about research. Firstly, you realize all the things that you don't know in your field. This is something that textbooks do not teach you. And if you do not have the perfect guidance in your clinical practice, you will not learn. But research humbles you and it keeps you open to possibilities. So it avoids boredom in your field. And also, if you are in a conundrum, it helps you support decisions you take, especially if you're working medico-legally. It helps you be more confident on the clinical floor. It helps you boost your confidence while making a diagnosis or treatment because it is backed by research. However, this, I would say, is a double-edged sword. Sometimes it can backfire, as I would explain over here. So the only disadvantage, if you ask me, being totally research oriented, is that real life is very different from clinical studies. So that is why we have things like an RCT, which is a randomized clinical trial where you have a group of people in a certain atmosphere who is part of the study, and then you have real world studies. So no two patients are the same. It reduces your risk-taking behavior, and more importantly, it doesn't prepare you somewhat for clinical life. That is what people in private practice as well as those in institution practice will differ on in this statement. Fine. So now that we've gotten this out of the way, so that you have some direction as to why you're part of this webinar, and once you're done with initial publications for USMLE or PLAB or XYZ, you should know why you are doing research. So let's quickly dive into the what, the where, and the how, the reason why most of you are attending this webinar. So the question easily comes as to what one can publish. So if I was in your place, it's very important for me to know what is within the scope of publishing and what is outside the scope, depending upon number one, my resources, and number two, my experience. So I would put a divide right over here and put things on the left side of it as things which come under the difficult category, and on the right side of it as things which come on the easy category. However, as it is easier to write from left to right, it becomes more difficult to publish from right to left. What do I mean by that? So ideally, if you are starting out, if you are yet to do your first publication, it's quite prudent to start off with a case report or case series. We'll be describing more about that in the subsequent slides. What I encourage a lot of my residents as well as interns to do is to think of places where you can do a lot of photo essays and publish a lot of images. These give you easy publications, and if you're in the right state of mind, it can give you a publication in a good journal. Letter to the editor is something that we will describe and discuss going forward. However, if you are in your post-graduation, you will be forced to write a thesis. And if you are forced to write a thesis, it is very important to understand that a thesis is very difficult to write if it's your first time, but it has huge amount of rewards once it is published. Finally, a lot of you, I think nowadays there is a lot of focus in online forums to write small narrative or systematic reviews. So we will cover that as well. But if you're a beginner looking at this, please target something either on the lines of case report or images if you are in clinical practice. And if you're not in clinical practice, but have the acumen or the time or the energy to go through major amount of literature, try for a narrative or a systematic review. One thing to remember when you're publishing is to remember this quote, which I read from this book by Show Your Work by Austin Kleon. So what he says is, done is better than perfect because perfect is never done. You'll never find the perfect publication. You'll never find the perfect work of art or the perfect study that was done. All studies come with limitations, either seen or unforeseen. Seen limitations are limitations that you know of right in the beginning of your study and you mentioned, but unseen limitations happen during the process of doing your thing. So don't worry too much about the study not being perfect right in the beginning. So the next question is, where can I publish? So you usually publish in journals. So many people are very confused about where to publish and how journals work. So that's why I bought this image on the right. So a journal is nothing, it's not very different from a magazine. So you have a title, you have an issue number over here, you have a date and a time, you have the important requirements of the journal, and then you have a polarizing image which is supposed to grab the attention. By the way, the person who's doing that, Ritvik, I can see you. So you might want to not do that. Okay, so this on the left is a journal. Just full disclaimer right in the beginning that my work or my lecture is going to have a lot to do with ophthalmology. So apologies right in the beginning, but I'll try to make it as common as possible. So when you're looking at a journal from the outside, it's very important to look at the indexation as well as the time and the place in which it was published, as well as the name of the publisher, the name of the journal, and the polarizing image as the cover photo. So try not to be too intimidated by a journal. It's quite similar to what we usually see. But here there's a huge but. This is what is on the outside. On the inside, there are three things that you must know about a journal. Number one is whether the journal is indexed or not. We will come to what does indexed mean. Number two, whether the journal is peer reviewed or not. And number three, what is the impact factor of the journal? So there are many indexing sites and there are many indexing platforms. So the simple way of understanding it is that if you go to buy a pair of shoes, you can buy them from Nike, you can buy them from Reebok, you can buy them from Adidas, Planet Sports, or some major shopping mall in which all these brands will be available. Similarly, you may choose to find all the journals of ophthalmology indexed in PubMed, indexed in Scopus, or indexed in Copernicus. So that's the easy way of understanding whether your journal is indexed or not. Peer review. So what usually happens is that the editor of the journal is in sole charge of the publication and decision about what gets published and what doesn't get published. But from time to time, he or she cannot handle the number of entries. So what this person does is that he gives it to a person who has allegedly the similar qualifications as the person who's submitting this article. So if the article has something to do with dry eye and computer vision syndrome in the eye, it will send it to someone who's proclaimed himself or herself to be a figure in dry eye or in computer vision syndrome of the eye and give it to them to review. Obviously, it has to be someone who also has credentials in publication as well. So that's the meaning of giving it for peer review. It's given to a peer. And depending upon the popularity of the journal and its citations over the last few years, there's a calculation in which we can calculate the impact factor, as in how impactful the journal is. So journals with high impact factors are journals which are more coveted, and you should try to publish in that. So a good impact factor is any impact factor greater than 1. Most journals fall in the category of 0.5 to 1, and a good journal will fall between the category of somewhere between 1 to 3. And there are, of course, journals which have very high impact factors, for example, 18, 20, etc. So how to know all these things? So now that we've reached a more of an internet era, it's not possible for us to know all these immediately. But again, I will take the example of ophthalmology. So if you go to the journal website, in this case, the Indian Journal of Ophthalmology, and you go into the journal info, which is over here, for any journal, you can find sorry, the impact factor of the journal and how the journal has been indexed, whether it is physically published journal or not. So the first thing that you must keep in mind is to have an idea about where you're submitting and whether what you're submitting to works out well for you. So this is a statement that you should maybe take a screenshot of and figure out for yourself. So the first thing, oops, so I'll just, yeah. So the first thing that you must understand over here is that ideally, so the ideal situation, it's not always possible to get an ideal situation, but ideally you should look for a physically published journal, which is peer reviewed, which is indexed in a state, national, or international platform with a high impact factor. It's very difficult to get your first publication in these categories, but if you can, that would be it would go a long way in your career. But if not, if you ask me, you should at least go for a well-indexed journal. Why well-indexed? Because if it's indexed in one of the higher categories like Scopus, Copernicus, or PubMed, or something of that sort, it will be visible on sites like Google Scholar or ResearchGate, etc. If along with index, if there's one more thing that you can keep in mind, try to go for a physically published journal as well, because these journals are usually published once in 3 months or 2 months or 4 months. So there's a regular rotation of these journals. So if you can take a screenshot of this slide, that would be great. These are important things to remember when you're choosing a journal. So the next question is, why publish a case report? So a case report, while you're beginning, gives you the right amount of exposure. This is something that you need to remember going forward forever. So a thorough review of literature with somewhere around 10 references is needed for the final manuscript. So a case report in its essentiality, I'm sure you have done case presentations during third MBBS and final MBBS. So a case report is nothing but a good case presentation written very well with a very good review of literature as a very cohesive discussion. So that's all a case report is. You do not need to make a mountain of a molehill and rethink how it has to be done. However, you must keep in mind that you must hit a target of 1,000 to 1,500 words. Why publish an original article? So this is where the word publication came in. Case reports came in much later, but originally we want to publish original articles. So in original articles, you usually have a research question or hypothesis. So what is a research question or hypothesis? So a very interesting example is, does smoking cause lung cancer? So it's a question equating A to B, and does A cause B, or will the existence of A affect the existence of B? So that as a research question would be, like I said, does smoking cause lung cancer? And that as a hypothesis would be, smoking causes lung cancer, and whether the hypothesis is proved or not. So after this, you must conduct a study. That means you must choose a sample size and either do a descriptive study or an analytical or interventional study, and finally end up proving or disproving your hypothesis. This has to be extensive at 3,000 words, should be more time consuming with an extensive review of literature. So I'm trying to break down both case reports and original articles in the simplest terms. So just remember, good case presentation plus review of literature is a case report. At the same time, an original article is nothing but a research question answered after a study. So what are the tools that we need to get started with publication? So terminologies are something that I will keep describing throughout this lecture. So that will be covered for you. Finally, we need to know how to go for searching and browsing. Finally, referencing, indexing, and finally, writing your manuscript. And as the lecture today is worked on avoiding plagiarism, etc., etc. Finally, some things which I consider very close to me, that is learning how to frame an exoskeleton of your manuscript, and finally telling a cohesive story. So the first thing over here is that if you are planning on publishing, the first thing that you will have to do is think about searching what is the existing literature available in your domain. So this is a very simple framework. Let's go with one simple question: does smoking cause lung cancer? Just keep reiterating this in your mind as I try to break down how to write a paper for you. So you think about this question, and the first thing you do is that you go to PubMed. So PubMed has this block in which you can write these questions, smoking and lung cancer, and see what are the articles that have been published. So now, if you do this for something as simple as the word research, suppose I search the word research, it gives me a lot of results. So how do I interpret these results? So the first thing that you want to see here is that there is 1 crore 49 lakh 48,795 results in which the word research is there. So it's impossible to go through 1 crore articles if I want to use the word smoking or the word lung cancer. It's very easy over here to search in PubMed by year. So in most cases, they will want you, or you would want to yourself, publish a paper that has been uh, reference a paper that has been published in the last 5 years. So it's very important to use this. You can search via abstract or full text. However, there is a smarter way to search, and that is searching via Boolean. So what I would like you to do is click on advanced search in PubMed, which is over here. It's also available on the homepage, by the way. And once you reach advanced search, you reach this page, which is the Boolean operator. So now what you can do is that you can choose to search for an article where the words are present together or not present together. So if I have the word smoking represented with S and the word lung cancer represented with L, I can search and. That means I search for all articles that have the word smoking or have the word lung cancer. If I search with and or, it searches all articles with smoking as well as all articles with lung cancer. And if I search and with not, it searches all articles with smoking without the word lung cancer. So if I want to do smoking with prostate cancer or smoking with breast cancer, for example, I want to do, I want to do eating chocolates with lung cancer or eating toffees with lung cancer, I can even do that. So you can see how advanced the search gets. Finally, something which I love to do in such a case is just press the button over here where all fields is there finally. And once you press the button, you can just scroll down and click title and abstract. So not only are you searching for the word smoking, not only are you searching for the word lung cancer, you're also searching for articles in which these two words are present in the title. So you can see how smart your search becomes in PubMed and how easily you can search through all this. So once you search for all these things, you want to put them in some place where they are safe. So you look at an article and you decide that, okay, this is an article that looks very interesting. It's very similar to what I want to publish. So my next objective is to save it somewhere so that I can reference it later. So that's when the word referencing comes. The word reference, as the word signifies, is to figure out how to keep it handy should you need it in the future. So historically, there are only three. Unfortunately, there are so many apps for so many things, but there are only three apps for referencing which are actually good. The one thing to remember is that the third one is paid. I have not used the paid version, so I'm not very familiar with EndNote, but those who are using it, it's fantastic. So I have experience in both Mendeley and Zotero. Um, Zotero is much more popular of late. In the last 1 to 2 years, it's become much better. Mendeley is more clean. It has a cleaner browser. For me, it has an inbuilt browser that helps me go for it. If you are starting off, my suggestion is start off with Zotero. Zotero is easy, it's hassle-free, and you'll find a lot of troubleshooting videos as well as links going forward. So I'll just explain my workflow in Mendeley. So since this presentation was originally made in 2024 and 2023, so it has a lot of COVID related stuff. So please excuse me for that as well. Okay, so this is my Mendeley library. So all you have to do is go to mendeley.com and download Mendeley or Zotero, and then you get something very similar to this called the library. So once you get in your articles, what you can do is add them to the library. You get a plugin on your browser, whether that is Chrome, Safari, etc., Firefox, and you can add them. You can convert them and create some files. So these are all the files of articles that I have decided to work on, and you can arrange these articles by year, you can arrange it by title, you can arrange it by author, etc., and you can go through it. The smartest thing to do is add everything, then add it to a folder, view it by year, and start finding the differences. So the interesting thing about Mendeley is that once you click on an article, you can open the article within the application and search and highlight it, which was not originally there in Zotero, but is there right now as well. So you have these links over here on the right-hand side that you can see where you can directly download the PDF as well. The Here, there's something to mention in detail is that not all sites and not all journals have all the details of all the articles. So it takes a bit of time to search for the right article and get yourself acquainted with it. So we figured out how to search for an article. We figured out how to store an article. Now I need to use this material to go forward. So over here, we need to start writing our article. So gone are the days of writing on Microsoft Word and using trying to highlight things and work out things in general. So what most people do nowadays is just make a Google Doc and edit in real time. Just keep sharing the Google Doc link between the authors and keep on editing on a master Google Doc. So even if your article is 12 pages, the master Google Doc is 80, 85, 90 pages because you're continuously making new editions of it. But what happens is that you have one master Google Doc that you don't need to keep renaming and emailing to one another. So if you ask me, get off Microsoft Word. Google Docs is much easier. So over here, you can see that these are all my articles that I was publishing. So I do a lot of mentorship courses for students. So most of my articles are actually named after the people who are working on the article. So as you can see over here is that there are these icons called collaborative posts. So if they're in collaboration with someone, their name is mentioned, and whatever changes I make gets made directly. So these are all articles that are in collaboration. Once it is final, all we do is download it and then submit it. Until then, we are still working on it. So you can see that you can open multiple articles and be on multiple conversations with multiple people. So once you're done with it, start importing to Google Docs. Right. So like I was explaining over here, I did have another screenshot. So you can always check who you're sharing with. You can share the article, and for the most part, both the softwares are absolutely the same. Just like Word, you also have a way to figure out who made what changes. It is much better than Microsoft Word. So you can also watch the person edit in real time. So over here, you can see there's a long timeline of who made what changes and at what time. So it's quite helpful. Fine. Now that we've described the tools, let's go back to the philosophy of publication and how we want to go about it. So like I explained that if you want to work on a case report, that is nothing but a case presentation with a healthy review of literature, that makes a case report or a case series. Now is the contents of each. How do we figure out what to put, where to put, and how to put? So I will describe all this in details, but let's just go through a couple of points over here. So certain things that you must keep in mind when you're describing something like this is the rarity of association. So there are two things that I want to speak about here. Number one is the word association, and number two is the word causation. I do not know if you can read my handwriting, but you must understand the difference between two words when you are thinking about writing. So the first thing is association, and the second thing is causation. So if I say smoking causes lung cancer, there is a particular pathogenesis by which smoking does cause lung cancer. So smoking causes changing of the surface epithelium and then causes carcinoma in situ and then causes full-blown lung cancer, and then there is adenocell carcinoma and squamous cell carcinoma, etc., etc., etc. So that is causation. It can be explained. But what if an article says that eating dairy milk causes lung cancer? I'm sure you see a lot of WhatsApp forwards where you see very vague things causing vague diseases, and then someone in your family is already getting paranoid about something like this. So that's what we actually call an association, that two things are associated with each other but are not correlated. For example, stomach pain and ear pain, they probably are never correlated, but if they are, then it's a causation, but in most cases it is an association. So you must find out whether this association between two diseases is rare in terms of the age of presentation, in terms of gender, or in terms of demography. It is very, very, very important to have the correct confirmation of diagnosis before you think about something like this. So if everyone remembers the COVID times, it was very easy to find out whether something was COVID positive, or when mucormycosis was the talk of the town. But only biopsy proven cases of mucormycosis were the articles that were accepted for publication, and not just cases in which people clinically observe black fungus. Also, if you have a unique management as well, that would help you in your case presentation. When you're reviewing literature, you must find literature that either agrees or disagrees with your hypothesis. It's very important to do that. You must find out how your article, your case presentation in general, is adding any value to the existing literature pool. If you ask me, what is the one thing that reviewers look at? They look at whether your article is adding anything new to the existing literature pool. Finally, you can always describe a possible hypothesis. For example, in cases of the eye, if one thing is, or one disease or one symptom is occurring more in the right eye to the left eye, a very common way of establishing a hypothesis is to describe how the arch of the aorta works, and how the right side of the body gets a direct supply and the left side of the body gets an indirect supply, and blame it on a vascular cause. So the hypothesis may not be so simple, but if you want to frame a hypothesis, you can jolly well go ahead. Finally, once you write it, it must have an introduction, a case report, a discussion, as well as a conclusion. Also, I'd like you to take a screenshot of this if you want, because this is the ultimate framework to writing an original article. This will be quite helpful for you going forward. So like I said, like I described previously, an original article starts with a research question or a hypothesis, after which you decide what kind of study you want to do. Do you want to do a prospective study? That is, decide on certain people and then decide, for example, you want to take patients who smoked and patients who did not smoke and include them in the study, and then decide which patients develop lung cancer. So that's a prospective study over 5 years. A retrospective study is you go through 5-year data of your hospital and figure out how many people are smokers and how many people are non-smokers, and find out how many people did develop lung cancer over 5 years. Then final thing is to collect your data, analyze it, compare your analyzed data with the existing review of literature, discuss the merits and demerits, value in the literature pool, and further study prospects. Obviously, be very honest about the data that you've collected. Finally, what you have described over here, you will either prove it or you will disprove it. So this is the ultimate result. So just to put things in perspective, discussing this is your introduction. Describing the type of study is your materials and methods. This entire portion is known as the results. When you discuss your results with relation to other studies in terms of merits, demerits, literature pool, etc., it is called a discussion. And finally, when you come to a conclusion as to whether it agrees or not, it is called a conclusion. This is all an original article is. If you keep this framework in mind, it's impossible to go wrong. Right. So let's go on to a couple of things which I want to speak about: statistics and data collection. So once again, like I had mentioned, it's very interesting or very important to be very organized in your research journey. So the first thing that one should keep in mind is to, just like throw away throw away Microsoft Word. Even though you do have Excel, Google Sheets works equally well. So if it's possible, I would request you to use Google Sheets. So when it comes to statistics and data collection, you must remember that Google Sheets or Excel data loves numbers. So it's very important to use numbers as much as possible. So if you have a look over here, if I'm looking at hypertension over the years, or diabetes over the years, or IOP over the years, notice that I did not put any value like millimeters of mercury or uh, the value of DM or hypertension, etc., etc. Everything is in numbers. Try your best to use multiple sheets to explain multiple sets of data. And finally, certain things that are already mentioned here, even if you're not sure whether data will be relevant or not, it's quite prudent to collect it. So your second page usually has pivot tables. So maybe we can take a class later on statistics and describe how to make these tables. But for the moment, you can always use page number 2 of your Excel sheet to collect data. Once again, Excel loves numbers. So over here, you can see that even when you are grading a disease, so for example, diabetic retinopathy can be graded as mild, moderate, severe. I've put the grading in terms of numerals, and I've added the numerals over here instead of adding things like moderate diabetic retinopathy, moderate hypertensive retinopathy, etc., etc. So it's important that we keep these things in mind when you are making Excel sheets. Finally, numerical data is king. Right, so we discussed how to collect data, we've discussed how to reference data, we've discussed how to arrange data, we've discussed how to write data, we've discussed how many things have to be put in writing when it comes to data. Finally, let's go on to what people get wrong most of the time. They have the data, but they don't know how to write it. They just make a mishmash of it all. So finally, your rough draft, your references, your master chart, your relevant figures, etc., goes through this funnel, and this funnel results in your final manuscripts. So over here, it is very important to learn how to tell a story. So certain things about storytelling actually change reality on whether your article gets published or does not get published. So this is something also that you can take a screenshot of. So storytelling is a practice. Here is how we differentiate a good storyteller or a good publication from another. Someone who has a background in reading books, in watching cinemas, in watching movies, in watching fairy tales will have a much better storytelling acumen. So it's what we learn that result in the results that we get. So finally, this is very important. When telling a story, you will have multiple data points, you will have multiple authors, you will have multiple drafts, and you'll have a lot of irrelevant data. Please decide on knitting them together before you go ahead. Start your story very close to the end as possible. For example, a patient developed lung cancer and something happened and developed a disease. Don't start from when the patient was 5 years old, and don't start from something else which is irrelevant, and don't talk about anything which is not related to your introduction and your conclusion. Choosing the right literature is very important. Being very prudent and just about outcomes that do not match your outcomes is very important. It should not happen in a discussion that you found that A is equal to B and you only cite the articles where A is equal to B and don't cite any articles where A is not equal to B. So happens very easily, and as reviewers, we very well know which of our articles are bluffs, so we treat them accordingly. And the conclusion should be very direct, research question, etc., etc. Your research question and your conclusion should answer what you are mentioning in your introduction. Finally, I want you to have a look at this gentleman over here. He has not done anything spectacular, but he has actually mastered the art of storytelling. So in a world where there are so many movies, so many directors, so many actors, so many ways of telling a story, everyone knows his name. I hope everyone is familiar with Christopher Nolan. So this is where no matter what article you get, no matter what way you're trying to write it, your discussion is and will always be the make it or break it portion of your article. If you cannot describe what you have, it doesn't work about. So like I said, the third act of your movie where you are in your director's seat. So your objective in your discussion is to state your findings, compare them with existing literature, remark whether your findings are in agreement or disagreement, and postulate why there is a differences and why your study is giving out an outcome, whether your study stands out, the reason why it stands out, and the reason why people should think about your study while thinking about the topic that they're reading. So if these 5 points are not there, at least for me, I reject articles because I know that the person who's doing the study is not aware why they're doing it. They're getting the result. They're getting smoking is equaling to lung cancer, but they're not understanding the impact this has. So without the impact, you will never be able to present a healthy discussion. When you have heaps of data and pages of data, it's very easy to lose the forest from the trees. So I always mention to have a very crisp data set. Finally, if you made it this far in the lecture and this far in your article, congratulations. It's not easy to sit through a research article, a research lecture for 40 minutes. So finally, if you want to submit a manuscript, go to the site of the manuscript. First, always check out the information to the authors. Even though I've mentioned many things in part and parley, there are many things that are very specific to certain journals, and it's quite important that you just check it out before you submit. All journals have a portion where you need to submit, declare something, and then go ahead with submission. So once again, this is a submission page. So this is a very common submission page for many journals. So you usually make an account, you register as an author, you put your details, and you enter in. Once you enter in, you have a page like this. It's very important to go through the templates that they have. If your journal has a certain template which they would like you to follow, it would be prudent to check it out. Uh, Finally, it has your articles that you are putting for submission, and it gives you a very good, easy dashboard. Once you're ready to submit your new manuscript, you click on the new manuscript and you submit it. Few points to keep in mind while submitting are that number one is that now you should transfer everything to Microsoft Word. It should be structured in, these are some simple things to keep in mind. Font should be around size 12 with Arial or New Times Roman, double spacing, and justify fonting. All references should be in Vancouver superscript. It's very easy to get this from Google. Photo should be in high quality with legends. Many people forget to send the legends. You will get a copyright and a contributors form from the article. It should be on the template page. That should be filled up by the authors. And finally, an extra documents. So now that so this completes the first half of it. The second half, I will try to give you as many examples as possible so that you can write a proper article, avoid plagiarism, avoid rejections, and move forward. So my ingredients for a good article are: number one, a prudent purpose. You must be very clear to the person who you're writing to as to why this article should be done in the first place. You must use words, or you must hammer in the words how it has an impact on future studies. How, if at all, it has an impact on future studies in your country. Does it change the way we look at management or treatment of a disease? Because quite frankly, these are articles that is worth publishing according to the author. Like I said, storytelling is a virtue. If your story is not compelling, if it's not worth listening to, I do not think it will get published. And finally, your take-home message should be very clear to your audience. Something that you must understand is that your message that you're trying to convey should be very clear. It should be very important that you choose what is suitable. So if you're presenting a clinical case report, it's better to present it, or you better to submit it in a journal that accepts case reports or has a dedicated case report for the journal. If you're submitting more of a journal related to community ophthalmology or community medicine, you should look at more community medicine related studies if you're doing a demographic study, etc. So Annapurna Ritu, admin, I'd just request you maybe to remove him or her for making the blue marks, because I don't know if they know, but I can see them. Anyway, so technicalities like sample size, choosing statistical analysis, gold standard for investigations, images and figures. So these are things that you must look through, like I mentioned over here in the information to the author section. So these are few things that change from journal to journal and should be checked out when going forward. Okay, so when we are publishing, what are the things that add to a good literature pool? Number one, uniqueness of a study. Number two, new modality. Or number three, so when COVID came, ophthalmologists around the country decided to publish a new report on the actual presentation of mucormycosis, even though we knew the presentation of mucormycosis is in coronavirus. This is already documented in every textbook, but we wanted to know it in COVID-19. So there was nothing new added to the data pool in this study. The only thing that changed during this study was that it added a huge amount of normative data to the existing literature as of the year 2019, 2020, and 2021. So it added 3,000 patients ka data, and that is why it was accepted. Nothing was new about coronavirus. Nothing was new about mucormycosis. Let's look at some more examples. Rare features of rare diseases. This is worth reporting. When you see something rare in OPD of a rare disease, it is worth reporting. So let's look at this title. This title will break your teeth, but if you are unveiling a rare etiology of secondary acquired nasolacrimal duct obstruction in morning glory syndrome with contractile nasoethmoidal encephalocele, this is something which is a 1 in a million diagnosis. So it easily gets accepted. So 1 in a million diagnoses are difficult to get in your career, but this was one in my career. So there were three associations which were completely unrelated to each other in a single patient. So if you do get something like this, it should be reported. Next, rare features of common diseases. So melioidosis is a disease that affects the southeastern countries with fever, malaise, headache. It's like a dengue for Southeast Asia. But we found something which is very typical or atypical in the retina in these patients. We found something which is known as soft exudates. So when these were present on the retina, this became a rare feature of an otherwise common disease, and therefore we got a publication in this stage. So once again, rare features of common diseases work as publications. Finally, what you will find most commonly in OPD, something that you should always keep an eye out, is common features of common diseases, but rare for age, gender, and population. So if you are looking out for patients, I'm sure you will see certain patients with some sort of hyperpigmentation in their eye. So this is usually called nevus of Ota. And this child happened to have a pigmentation on the back as well. So what we did is that for the longest time, we kept asking patients with pigmentation in the eye, can you show me your back? Do you have pigmentation on your back? And if they did, we would take, and we found a case which had a combination of nevus of Ota as well as nevus of Ito. So even though nevus of Ota and nevus of Ito are very common, them occurring together was very unusual, and therefore it led us to get a publication. Finally, let's talk about a very compelling story. So I think this is something which is discussed at length in general, because many a times when we are discussing patients in critical wards and etc., we want to report an interesting case, but unfortunately the patient passes away. So this is an article where we presented, is the same article from last time, but unfortunately the patient succumbed to his illness, but that did not make the report unpublishable. So we found a way to speak about the disease. The soft exudates, like I mentioned in the previous slide, were not treated. But in spite of that, we managed to publish it. Why? Because we were very clear in the way we are trying to express this disease. So even if the patient dies, even if there is something that doesn't go the way you want, if you are honest about it, it can get published. So starting your story as close to the end as possible. So this is another article during COVID-19 that we had published. So over here, we had described ways of doing wet lab in the presence of COVID-19. So over here, the most important thing to remember is that wet lab training is nothing new in ophthalmology, is nothing new in medicine, but a new way to do wet lab training is new. So the more you think about innovative ways to work out, the better it works for you. Finally, I keep talking about Christopher Nolan and a compelling story, etc. But how does Christopher Nolan or a great director write a compelling story? So the most important thing to do is create an introduction or a purpose. Number two, create rising action or crisis. So this is a 3-act structure. First, you mention the diseases, the outcomes, the interplay that the patient presented with. Then you go on to mentioning what and how tests were negative, examination was negative, and finally you come to the conclusion about the clinching test and the diagnosis, and you reach a climax. The more you convert your story into something that is readable, palatable with the adequate references, the more compelling it becomes. So this is one more example. So we were the first to report bilateral optic neuritis as a sequelae of COVID-19. This was the first paper of its kind. So we did not know exactly that COVID-19 can cause something like this. So you must notice over here, the purple portion represents Act 1. What are we doing in the purple portion? We are talking about the variables. We spoke about COVID-19 being a variable. We spoke about sudden onset vision loss in a 56-year-old female being a variable. We documented the findings. What is part two? It is rising action or crisis. Let's look at part two over here. So the rising action is that we found sluggishly reacting pupils. We found something that represented optic neuritis. MRI was otherwise unremarkable. We did MRI of the orbit. Blood investigations, there was nothing suggestive. Finally, we give the diagnosis in Act 3, which is the green portion of the article. So over here, we say that we started the patient on empirical steroid therapy and there was a full recovery in vision with a slight color defect. So we've clinched our diagnosis that this patient did have bilateral retrobulbar neuritis, which responded to high dose of steroid therapy. So notice how the structure is, sorry, how the article is structured as a 3-act structure. So these are few things that it's very important for someone like me to mention. Number one is that if you are not able to do the complete examination, please disclose it, because if the reviewer finds out, he or she can be compelled to reject your article. Number two is that remember that all manuscripts have shortcomings. There's no point in describing your manuscript as the best study that was done or the best XYZ that was done. And finally, if you are very honest about your shortcomings, there are chances of acceptance versus if you're trying to hide these shortcomings. So, like I said, you must know how to choose your journal for your initial draft. Like I said, if you must decide whether your paper falls under a clinical paper, research paper, or an academic paper. And this is something which I want to instill in everyone who is listening over here, is that always submit to the highest category. If you're submitting in cardiovascular medicine, or if you're submitting in orthopedics, or you're submitting in neurology, just Google what are the best journals that are available. And in ophthalmology, if you look at the 2022 Google Scholar ratings, these are the best journals, and Indian Journal of Ophthalmology comes at number 12. If I was resubmitting my articles, I would submit to the top 5. Why? Because there is a high chance of rejection, but if they reject your article, they'll probably tell you why they're rejecting it. And you can always make these changes and submit to journal number 6, 7, 8, 9, and 10. So what it does is that it makes your article more foolproof. It has a third person read your article and give you data about your article. So now moving on to articles to case reports. So not everything falls under an original article or case report. Sometimes you may have interesting photos of clinical relevances. So if this is your first attempt, like I mentioned, or you do not find anything interesting to report, you can go for these images. So you can see some images that I've highlighted. So this is a rare photo of very different posterior polar cataract presenting with a very bookish type of cataract called cataracta centris purpulentia. So this got a publication because it had a very unique name with a unique cataract, very uniquely photographed. Finally, we all see leash nodules in neurofibromatosis, but rarely do we see some site of asymmetry in leash nodules. So this is one type of structurally leash nodules, and this is another type of structurally leash nodules, and it was presented for its asymmetry. Finally, this is something which I described previously because they were present together. It was what? Right. Next is the power of a letter. So what originally, let's just describe what happened to letters to editors and why they are actually famous. So before the 2000s, maybe in the early 90s or in the 80s, when journals had a little bit more reputation than they have in today's day and age, once a journal was published, there was no way to contact the editor. So the editor made a section called a letter to the editor, where you could write to the editor regarding any misinformation that was there in the journal, any suggestions that you had for the journal, and the letter would be published. Over the years, it became an official publication, and nowadays letter to the editor is used to increase your publication effect. So this is one very simple letter to the editor during COVID-19. It just described how instruments could be worn on top of the PPE. So describing it again as a 3-act structure, you could easily get a publication during that point of time. So these are some letter to the editors that we had published during that point of time. So what is important to know is that they're more perspective based, but they do require 5 to 10 references going forward. So I think we are 50 minutes in our lecture, and if you are lost, disoriented, perplexed, or confused, at least you have some direction as to how to start or how to begin writing these research papers. So what is my lucid take-home message? So you must know your journal that you want to submit to. You must aim for the highest journal. Like I'd expressed over here, that your manuscript should be very short and sweet. Ideally, following a 3-act structure makes your manuscript very uniform. You must conclude accurately and be honest about your shortcomings. So my lucid take-home message is like a packet of Lay's. When you open it, it should be crisp to taste. Your writing and your article or your manuscript should be crisp to taste, have the right amount of salt, be infused with flavor, and keep your reviewer longing for more. So thank you very much for your attention. So if you are listening in, you may find me on LinkedIn as my own name and on Instagram as Freeze Thought. And I do have some amount, I do work with undergraduates and postgraduates when it comes to research. And I have a small team which works from time to time. So if you're interested, you can be a part of the team. And I do occasionally give out opportunities where I need ghostwriters, etc., etc. If you do have any questions, please only text me with your CV so that I can reply simply to you, or else you can follow me on these platforms and we can have a small chat. Right. Uh, Thank you so much to the organization for all the suggestions and all the help and for actually hosting me. I think it's a really good webinar. I think we had 60 people throughout. So I think that's really good for webinars in 2025. Uh, Back to you, Rajvi. If there are any questions, we can take them. You're muted, Rajvi.
We can have question if anybody has. Please drop in your questions so we can discuss.
Sir, can you please tell where to subscribe for physical journals and which ones to get? So I have a very simple policy over here. As far as physical journals are concerned, it's no need to subscribe to them in today's day and age because they all have online prints, except for British and American journals, which have very high subscription fees. Most of the journals are available online, but just for your curiosity and for the advancement of your knowledge, whichever specialty you're in, try to subscribe to its All India Journal version, number one. And if you have any subspecialties in that, so for example, in ophthalmology, we have the Indian Journal of Ophthalmology, which is the national journal for it. And we have a state journal. So if you feel your state journal is worth subscribing to, please subscribe, or at least subscribe to the national journal. And then, for example, if you have an interest in cataract or retina or something like that, then search for high ranking journals in retina or cataract. And if you only one, then only subscribe to it. So that's my 2 cents on it, because nowadays everything is available without a subscription. There's no need to subscribe, but if you want, that's what you can do. Thanks for your question, Shamvora. So where can we publish the case report? So if you Anaga, so usually you want to judge what kind of case report you have before you choose your journal. That is number one. Number two is that once you have judged whether your case report is more clinical, whether it is a describing case report, like I'd shown you a couple of them, or whether it is an interventional case report, you can decide on a clinical journal. There are many clinical journals that are available, which many students submit to, but my honest feedback to everyone is that try your best to avoid spurious journals over here. And if you can, try to search for a subspecialty journal. For example, you're looking at orthopedics, look for Indian Journal of Orthopedics and go to their site and see if they accept case reports. If they don't accept case reports, then there's no point in submitting because it will get rejected. For ophthalmology, Indian Journal of Ophthalmology has an Indian Journal of Ophthalmology case report section. So you can always submit over there. If you cannot, there are a lot of general journals in which accept general, for example, medicine journals accept case reports from everything. Can we submit the same research paper to ICMR STS as well as journals like PubMed? So I'm not very sure about ICMR STS, whether you can submit it to PubMed, but PubMed is not a journal. It is an indexing platform. So you cannot submit it to PubMed, but you can submit it to a journal that is indexed in PubMed. So that's the correction over there. Sir, is spending time in research fruitful for a first year student, and how do we get started with it? So do you mean first year undergraduate or postgraduate? At any point of time, something that you do not know, so undergraduate, great. So I would say as an undergraduate thing, it is very much fruitful because the earlier you understand research methodology, the easier it is for you to understand studies later on in your career or life. Uh, in terms of fruitfulness, you must use the knowledge that you are learning and apply them in the subsequent years, or else it is not fruitful. But in today's day and age, there are a lot of opportunities that are available with research. So my short answer would be yes. My long answer would be have some goal for yourself to make it fruitful. Is publishing in preprint? Yes, of course, it's useful. Yes. Is publishing in preprint useful? Yes, it is useful. Karthik Khanna. So preprint versions are as useful as the final print version. It's not a big deal. So anyone else with any questions regarding actually any doubts you had regarding the presentation, etc. The one thing that I would just like to add is that research papers and writing research papers is quite similar to mathematics. So there are only certain amount of theoretical things that you can pick up from webinars and coaching sessions and long sessions. Just like mathematics, there are only few formulas to learn, etc., etc. It's the application of it that matters the most. So that is why I put the initial few slides mentioning about how your first paper need not be perfect. If possible, your first paper need not be PubMed index. If possible, your first paper might be all trash. But if you do not start writing and submitting, you will never be able to cross the first step. So once again, I tell everyone over here that research is for everyone, and you can gain a lot of name, a lot of reputation, a lot of insight, a lot of perspective from research, but you must start. Webinars like this, I hope I was able to help everyone listening by one step forward, but the real step will take is only when you start writing your first paper. How to conduct a cross-sectional study? I'm totally new to this field. So cross-sectional study is where something is happening, but you only take a snapshot of time. You only take a certain cross-section of population. So a good example of cross-sectional study would be, for example, you are taking many patients with diabetes mellitus, and you decide to give them a questionnaire suddenly during their visit and ask them whether your long-standing history of diabetes and your medication for diabetes is causing you anxiety and depression. So that is basically, I think there is something called a HATS questionnaire, hospital anxiety and depression score. So suppose you take every patient that comes to your OPD and you make them fill up this questionnaire. So, and then you take the results of the questionnaire. So one person might be diabetic for 10 years, one person might be diabetic for 1 year, one person might be diabetic for 5 years. But in a cross section of time, you made them fill up the study. You classify them as the duration of diabetes, and you classify them as the response they gave to you. And that ultimately becomes a cross-sectional study. So that becomes a descriptive cross-sectional study where you describe that what are the mental statuses of the patients who have diabetes mellitus who have come to the OPD. So that's a very easy cross-sectional study that you can do. Diksha Pai, sir, could you please suggest a few research topics in ophthalmology in today's date? Research topics. All my research interns are working on AI in ophthalmology. So all you need to do nowadays, like in my time, it was take something on COVID and publish it. All you need to do is put everything in ChatGPT, in Claude AI, or in what is the other one which my people are working on, Google Gemini. So you pay 1K to for the paid version of these, and you take one ophthalmology image and you pass it through that, and you check whether the ophthalmologist is giving you the right answer or the AI is giving you the right answer. Everyone is doing this study. Whoever can publish it first is like, it'll become like the chicken came first or did the egg come first. But anything to do with AI interpretation through these chatbots will get published extensively towards the second half of 2025 and maybe into 2026, because ChatGPT and all that is getting better. So I'd suggest, off the top of my head, something from there. Probaho asks, Sir, I have done a retrospective audit of nasopharyngeal cancer over 35 patients. At what stage they came, what treatments done, etc. Where and how can I publish it? Is it good enough sample size? So I'm no one to answer whether it is a good enough sample size. So what you have to do is to look for the incidence and prevalence of nasopharyngeal cancer. If the incidence and prevalence is low, you have to calculate the Cronbach's alpha for this disease. You have to give it to a statistician and calculate what is the actual incidence in the population. So depending upon the incidence and the confidence interval for this disease which is reported in your region, whether you find an article from India or you find an article from your region, you can decide whether it is well reported or well presented or not. So from there, you will know whether a low sample size or a high sample size works. For cancers, 35 sounds like a decent enough sample size. So that's the question about sample size. It has to be done by a statistician from prevalence studies. It cannot be discussed in general. Number two is where and how can I publish it? So you have to be very careful about what you're auditing, what you're trying to find out. If you're just going to find out some demographic factors or descriptive factors of nasopharyngeal carcinoma, you must do it with a thorough review of literature, because otherwise your data doesn't have anything relatable. And you must come out with at least 2 to 3 conclusive comments on your outcomes in your 35 patients, which conclusively describes the disease in your age, sex, population, demographic data. Then only you can think about publishing it. Anshuman Pati asks, are we going to get any certificate of participation? Most likely not. I don't know if Raj will want to disagree with me. How to search and choose an important research topic, sir? So firstly, how to choose a research topic. I think it went back to polls and quizzes. Let me just go back to the chat bot. 1 second. Yeah. So how to search and choose a research topic. So the first thing is that you have to observe what comes in your OPD, or observe what comes in your ward, or observe what are the trends and patterns that are there. Like I told you, you have to search for common features of common diseases in large populations, or uncommon features of common diseases in smaller populations, or rare features of rare diseases in very small population. If you look at the example that Dr. Prabhas cited, he's looked for an uncommon disease. We do not know, or he has not mentioned whether it is uncommon in his population. He's not mentioned anything about age, sex, demography, details of the patients, blah, blah, blah. So if he has nasopharyngeal cancer in an uncommon age group and in an uncommon population, that solves it. He can easily go ahead and publish it. But if he has nasopharyngeal cancer and it turns out to be a very common disease, he cannot choose it as a research topic. He has to go for at least 100, 200, 300 studies. For example, in spite of having so many mucormycosis, I showed a study in which we could only collect 2,800 cases of mucormycosis. I think on a daily basis, there were 3 to 4 reported. So there were much more. Thank you for a very nice session. You're most welcome. I stay in Kolkata. Hope to meet you offline as well. You have my address. It's my hospital, so you're most welcome to come and meet. Uh, yeah, hi Rajvi.
Yeah, so what is the best plagiarism site and any good free site you would suggest?
So what happens nowadays is that in most journal submissions, they offer you a plagiarism check for free. So of late, I have not been using plagiarism checkers. So even I'll just share my screen once again and show it. But most sites offer free plagiarism checking in general, and your technical review will give you the plagiarism check if you are working. So I don't do much of plagiarism checks before submitting my article, because if you're writing it very honestly, it'll still hit 10% if you're copying a very thin disease. So it's fine. Hannah SD asks, systematic analysis or case reports. One second, sorry. Yeah, systematic analysis or case reports or cross-sectional study or clinical trials, which would be effective and would be easily indexed for a 2D year, okay, second year medical student. So I don't think as a second year medical student, anyone is going to give you an access to a clinical trial, because I'm getting an access to a clinical trial. I'm getting access to my first clinical trial, and it's been quite a while. So I don't think clinical trials fall under this thing, because it's very extensive, and clinical trials usually take years and years to get submitted. So by that time, you might become an MBBS doctor only before your clinical trial reaches publication. Secondly, systematic analysis, if somebody is doing a lot of research for you and letting you know what the research needs to be done on, then you may consider systematic analysis. But other than that, I've cited a lot of examples. The easiest way is to get case reports or cross-sectional studies. For second year MBBS students, I would seriously suggest that your final years or your interns or your house staffs, they're usually overworked, but they see more cases. If you know someone and you can approach them and offer your helps. Remember, the more junior you are, the more better you should, the more openly you should offer your workforce, as in your brute ability to do lag work. But the more senior you are, you can offer your wisdom, etc. So my suggestion is, go to your hospital, search for interns, house staffs who would be willing to share their data with you, for you to write it for them. I have a case report. Sorry, Tanya Agarwal 1010 asks, I have a case report on radiological rare case. So how do I go about that in a journal? So right now, what you are telling me, Tanya, is very vague. So you have to be more specific on radiological rare cases, what you mean by that. So if it is radiological rare cases, first you need to find out whether it is rare by our standards, or it is actually rare in population by incidence and prevalence studies. So if it is not rare, then you would not get a very good chance to publish it. But by incidence and prevalence studies, if what you have found radiologically is also very rare, the ideal thing would be to, if it's a very, very rare thing, then you can just report it as a case report. But ideally, it's better to collect a small case series and then report it.
I have one more. So, is there a minimum number of articles required for writing a narrative review, or can it be conducted with a limited number of relevant studies?
Usually it's around 40, most journals accept 40. Okay, sir, thank you. Star asks, Uh, sir, how to search topic for meta-analysis? So meta-analysis, if you ask me very honestly, unless someone prompts you on a directional meta-analysis, is very difficult for anyone to decide what should be meta-analyzed, because meta-analysis is only work very, very deep into super specialty and subspecialty. Like, you cannot do a meta-analysis on the current anti-diabetic drugs like pioglitazone or something that is present, and the outcome of it, because it's too vast a meta-analysis. For example, if you do it on metformin, you will get, like I showed you right in the beginning, there were 1 crore 49 lakh studies. You will get something around 3 crore 49 lakh studies on metformin. So meta-analysis, unless someone is already in the super specialty and is guiding you and telling you that this is the topic in which you need to do it, because then you would only find around 10 to 12 to 15 to 20 articles, sensible articles going forward. I'll give you a very interesting topic to do a meta-analysis. So in ophthalmology, we have a subspecialty called glaucoma. In glaucoma, we have a subspecialty called minimally invasive glaucoma surgeries. In minimally invasive glaucoma surgeries, there are only 8 surgeries, out of which one surgery is called eye stent implantation. So I will just write it here so that everyone can understand. Eye stent W. So this is a very rare injectable implant that is available for glaucoma. So there in this subspecialty in this thing, sorry, it's gone directly chat with everyone in the meeting, correct. So this is iStent Inject W. So this stent, there have been only 3 lakh implanted, out of which studies have only been done 10 or 15. So if anyone wants to do a meta-analysis on the efficacy of iStent in glaucoma, that can be done as a meta-analysis. So topics of meta-analysis are very difficult to understand in undergraduation. Like, I'm pretty sure what I said went over many people's heads, but I would suggest that if you are not accustomed to case reports, case series, images, original articles, aim for maximum a narrative review. I think we are done with questions.
As we come to the end of today's session, I want to sincerely thank Dr. Anil for